Community HIV/AIDS Program at the Health Resources and Services Administration, HRSA. Today's webinar, The Many Faces of Public Health Service, features two distinguished panelists, Lieutenant Commander Darnell Thomas and Commander Karen Ortega, both assigned to the Immigration and Customs Enforcement Health Service Corps. Our expert panelists can help to acquaint you with the multiple career options within the public health arena, specifically the U.S. Public Health Service. Today is a great opportunity to learn about an exciting, diverse, and rewarding career path that might be a good fit for you. The U.S. Public Health Service is one of the 7 uniformed services. The mission is to protect, promote, and advance the health and safety of the nation. There are 11 professional categories, and dentistry is one of them. We do have a short 8 to 10 minute overview presentation on the event page if you would like to learn more about the U.S. Public Health Service. Both of our panelists are dentists, and they've chosen to take their careers into the public health arena. After graduating dental school from the University of Texas Health Science Center in San Antonio in 2008, Lieutenant Commander Darnell Thomas was commissioned into the U.S. Air Force and served 5 years stationed at Lackland Air Force Base, Texas, and Nellis Air Force Base, Nevada. His first duty station with the U.S. Public Health Service was with the Bureau of Prisons at FCI La Tuna in El Paso, Texas. After 5 years with the Bureau of Prisons, Lieutenant Commander Thomas transferred agencies in 2018 to begin work with the Immigration Health Service Corps, also in El Paso, Texas. Commander Karen Ortega graduated from Indiana University School of Dentistry and received a Master of Public Health degree from Indiana University School of Medicine. Commander Ortega started her career as a public health service officer detailed to the U.S. Coast Guard. The first 5 years she served in Cape May, New Jersey at the Coast Guard Training Center and 2 additional years at the Coast Guard Boat Station in St. Petersburg, Florida. In 2018, Commander Ortega transferred agencies within PHS and started working for Immigration Health Service Corps near Houston, Texas. I'll now hand it over to Elizabeth Johnson, Director of Recruitment for ADIA Application Services, who will facilitate our panel discussion. Liz?
Great, thank you. Well, I just wanted to say thank you, Shayo, and thank you to Lieutenant Commander Thomas and Commander Ortega for being with us today. Before we get started, 3 brief housekeeping items. All attendees are in listen-only mode. This webinar is being recorded and will be available in the next few days on the ADIA Go Dental website. And finally, please ask our panelists questions. Use the Q&A box to send in your questions. At the end of the panel discussion, our 2 speakers will answer as many questions as they can. So without further ado, let's get started. Our 2 panelists will give a brief introduction and provide an overview of their day-to-day roles. Lieutenant Commander Thomas, we will start with you.
So, like they said, I'm Lieutenant Commander Thomas. I've been in the Public Health Service for the past almost 6 years, and I am now stationed here in El Paso, Texas, with Immigration and Customs Enforcement at our facility here in El Paso, Texas. The everyday role, day-to-day role that we play as chief dentist with ICE is very busy. Our main goal is to maintain or improve the health of our detainee population. Our detainees are here for multiple reasons, as far as either being deported or fighting for asylum in the United States, and we provide dental care for them. We provide comprehensive dental care. We do extractions, restorations, endodontics, and perio. The only thing we do not usually provide is prosthodontics due to their limited stay with us in our detention facilities. Our patient population is very transitory, and so, like I said, they are with us for a very limited time. So we do the best we can with what we have and provide the care that we can possibly provide while they're in our stay. My facility, we house about 950 detainees. and we're responsible for performing a variety of administrative and also obviously clinical services for our detainees. We provide oral health care screenings, examinations, and then we diagnose and treat.
Great. Thank you very much. That sounds pretty exciting. Commander Ortega, you're up.
Hello, everyone. Dr. Thomas stole my thunder. He just took everything I was going to talk about. But well, but let me see if I can find a couple more things. But just a little introduction about myself. Born and raised in Indiana, went to dental school in Indiana. I've been a public health service dental officer for 8 years now, a little over 8 years. And I'm currently, just as Dr. Thomas, working for ICE. ICE Health Service Corps is the agency that we're detailed to. But first and foremost, we are public health service officers. And as public health service officers, I'm sure that you've heard from a couple, if you've attended the previous seminars, there's different areas within the public health service that you can work. And it's pretty easy to experience different sections if you wanted to. So if you liked where you're at, you can stay. If you wanted to move around, you could also do that. So I had been, had the opportunity to start out being detailed to the Coast Guard. And then just last year, about the same time as Dr. Thomas, we both were transferred. He went from BOP and I came from Coast Guard to ICE. So learning a new agency still, it seems like new things pop up each day. But yes, we are in a clinical dentistry role. And we do somewhat limited here with more emergent cases or urgent, but also a little more complex cases that we see, little different than Coast Guard, which had more healthy younger men and women that we were more so maintaining health over time every year, you know, doing more exams and making sure everybody was ready to deploy. And at my site here, I've got about the same as Dr. Thomas now with patient population-wise. We have the space here. We're a new facility that we could get up to about 1,400 people. So it's just me, 1 to 1,400 possibly, but right.
So my apologies. Everyone who's been very patient and on hold. Somehow there was a very bad technical glitch and we just got started on the sharing. So my biggest apologies. I don't know what happened. So actually, Lieutenant Commander Thomas, can we just go back and start with your first question? I'm very sorry. This
Sure.
is not my day, apparently. So let me get started again. Everyone, thank you so very much for being patient. I apologize. So we didn't miss too much yet. So the first question I had was just having our panelists do a brief introduction of themselves and kind of their day-to-day roles. So again, I apologize. And Lieutenant Commander Thomas, we are now officially on air, so please take it away.
Yes, ma'am. So I am Lieutenant Commander Darnell Thomas. I'm originally from the Dallas-Fort Worth area, and I went to school at the University of Texas Health Science Center in San Antonio. And just kind of an overview of, you know, I graduated back in 2008, and then I actually just recently in 2019 got my master's in public health. But just an overview of our day, or, you know, our day-to-day role as a chief dentist with ICE. It's very busy. Our main goal with ICE is to maintain or improve the oral health of our detainee population. We provide comprehensive dental care. We do extractions, restorations, endodontics, and periodontics. Our patient population is very transitory, so our usual length of stay is about, you know, 43 to 40, at my facility it's about 43 to 45 days. So we don't do any prosthodontics with this patient population. We while our patient population here in El Paso is probably about 950 detainees, and we pretty much do everything for them as far as dental care is concerned. We provide our primary oral health goal is to include examinations, the diagnosis, and treatment of patients, and we also can refer out to specialists when needed or appropriate. Other than that, that's kind of in a nutshell what we do here in the detention facility in El Paso.
Great. Thank you very much, Lieutenant Commander Thomas, for that again. And Commander Ortega, please take it away on your side.
Sure. Thank you so much. I'm Dr. Ortega, and I've been in the public health service for about 8 years. Born and raised in Indiana, graduated from Indiana Dental School, and then came straight into the public health service. Once I started the public health service, I started out with the Coast Guard, like you might go back and hear on the introduction. Started out with detailed to the Coast Guard for 7 years, and then just recently last year, Dr. Thomas and I both transferred agencies, and we are both learning new skills with Immigration and Customs this year, within the past year, to ICE Health Service Corps. But yes, we are we do clinical dentistry, is our day-to-day practice, and we do a little more urgent care than all the things that Dr. Thomas mentioned. We can do and do. But mostly we're trying to ensure that no emergencies or people with severe pain go too long without seeing us. So we try to, as quick as we can, see patients as needed. And like Dr. Thomas said, the average length of stay in each facility here is a little different. His is more like 40, I guess he said, but mine is about 13. So very high turnover rates. So we try to see people as they come in, but a lot of times you schedule them and they may not be here to be able to do the treatment sometimes. And our facility does house up to about 1,400. Right now we're about the same size as El Paso, patient-wise, about between 800 and 900. But we can get a lot bigger, and only one dentist here, so it's just me to send for everybody. So it's pretty busy.
I would say so. A little overwhelming too, I'm sure. Well, thank you very much for that. So, kind of staying with you, Commander Ortega, tell us a little bit about the influences and experiences, that led you to your current career path.
Sure. Well, I actually was one of those people who knew way back, probably about the 6th grade. I had braces, and I liked my braces, so it just kind of developed from there. I had a really good mentor, private dentist that my family had grown up with, and he was great with mentoring me and allowing me to go back to the office and do assisting. And then once I got to undergrad, I shadowed a lot. I job shadowed. I got into a job shadowing program for pre-dental students that got to see dental laboratories behind the scenes, as well as dental offices or dental specialty offices. And so that had really helped me develop a broader view of dentistry before I got to that point. So I'm still on the same path, finally got into dental school. And then in dental school, we had a lunch and learn by the Indian Health Service, and they came and graduated, a student that had previously graduated from Indiana came back and gave a talk on her experience in Alaska, and just told about the Indian Health Service and how you can be in different locations and out west, and you can be work for the tribe, or you can be a commissioned officer. So that's kind of where I thought, oh, well, that could be fun, pick up and go out west. I like to be outside and do hiking and biking, so I thought that would be a good way to be able to have fun and not have to worry about a private practice or continuing with any more school after dental school. So that's kind of where I started from.
Great. That's pretty neat experience. Lieutenant Commander Thomas, how about yourself?
So when I first learned about the public health service, I had never heard of it when I was in dental school, but when I was serving in the Air Force, my office mate was in the Indian Health Service before he came to the Air Force, and he told me about it. And we had just had our first kid, and the Air Force is moves a lot more than the public health service does, and so I looked into the public health service, and there were some positions here in El Paso and in Texas who wanted to get close to home, and that's when we decided, let's make the move. And I did an inter-service transfer from the Air Force to the public health service, and was picked up and was at the BOP for a while, and then I actually heard about the ICE Health Service Corps, which was also here in El Paso. And they told me it was it'd be a promotion as far as, because I was just a staff dentist with the Bureau of Prisons. And so I did a transfer, agency transfer to ICE. And I've been there for the past couple of years and really liking it where I'm at.
Great. Thank you very much. Staying with you, Lieutenant Commander Thomas, what kind of surprises people the most when you tell them about your career, specifically your current role at the ICE Health Service Corps?
Well, I think with as far as what surprises people the most is our detainee population. They don't realize the number of immigration detainees there are in the U.S. We have a total of about 16 facilities, and each one is, like Commander Ortega said, are different, but each one houses anywhere between 700. Well, our prior smallest is about 325, but our largest ones house about 1,500 detainees, and people don't realize the diverse population that we see, and they also don't realize the depth or scope of dentistry that we provide for the detainee population.
Yeah, I can imagine. It's kind of a unique job. Commander Ortega, do you have anything kind of to add to that? Is there anything else that somebody has said to you that they thought was surprising about your current role?
Just to piggyback on that, very similar. Nobody really knows that we are here. And in the public health service in general, I think people are surprised because nobody knows what public health service is. And when I tell them, oh, I'm on active duty and I wear an official uniform, so very surprised with that. Nobody, it seems to still be a mystery to most people, even though it's been around for a long time, 1798, I think. I should know that. So that part is always surprising to people. Specifically within ICE, I would say if we weren't here, about some people I've heard like, oh, well, why are you providing free care to people who aren't paying for it? Well, we are, they are in our custody, so it is, we need to take care of people in that sense. And then if we weren't here providing these basic services, like if a tooth needs to come out and somebody's in pain and they need to go out to the hospital or emergency room for a simple extraction, and they see an oral surgeon there, it's going to cost taxpayers much more money, to send these patients out when it could be resolved, within the agency by employing public health service officers to provide the care within the centers.
Sure, that makes a lot of sense. Thank you both. So Lieutenant Commander Thomas, kind of shifting gears a little, if a student came to you today, what advice would you give them about the multiple pathways, that are offered in the profession of dentistry?
I think, this is advice I wish I would have taken when I was in dental school, and it's to try everything and to get involved, to get more involved in, the different different work groups and different committees that are available to you while you're in dental school. You never know where you'll find your passion, and you don't know unless you try it for yourself. I had great mentors while I was in dental school. I just wish I would have tried everything, especially I really didn't understand the role of dental public health or public health in dentistry until much later in my career.
Oh, that's great advice. Thank you. And Commander Ortega, how about you?
Yeah, I would say don't limit yourself to only thinking there's private practice or corporate dentistry. Just know what's out there, all the options, and see whether it might be a good fit for you. For example, just within PHS, one good thing is you really don't have to focus on production or meeting a quota or how to grow your practice. You can just focus on doing a good job, doing dentistry, and not have to worry about getting the patient out the door or out of the chair. So another good thing, you don't have to sell anything. You just go to work, you go home, and you get paid. So it's really nice in that sense. And just the options that within public health, there are, non-clinical jobs, administrative, and so you can kind of bounce back and forth, depending on what you feel like doing. You don't have to be set in clinical dentistry. You can do more research. There's just a lot of different options that you may not know about in dentistry. So definitely find out as much as you can before you make a decision.
Great. Thank you very much for that advice. So just one, final question before we jump into some Q&A. Are there any, you covered a little bit, I think, on your last answer, but, are there any tools, tips, or resources you recommend to help graduates discover their career path? Lieutenant Commander Thomas, why don't we get started with you?
Yeah, sure. Another thing is great resources while you're in dental school is get as much insight from your professors. They're kind of scary at first to try to talk to, but they have a wealth of knowledge, and their career paths were, they vary just as much as anybody. They've had their careers, and they know the ins and outs of, and the pros and cons of dentistry. And many faculty are either ex-military or they might even be ex-PHS officers. At the Health Science Center in San Antonio, we had a big ex-Air Force faculty staff there, and they were great and helped guide me, to my path my career path. And they really helped as far as mentoring me and getting me, the right contacts as far as scholarships go, and figuring out where I wanted to go within my career in the Air Force. And also, while you're also in school, you have access to every specialty there is. There's 10 dental specialties, and all 10 of them are there at your school, from orthodontics to dental public health, probably. And they would probably be more than happy to mentor you or to guide you and give you the opportunity to experience what the day in the life of a dental public health dentist is like, or endodontist. So I would say just use your resources that are right there at your fingertips, and you'll be surprised at what you can find.
Great, thank you so much. And Commander Ortega, anything to add there?
If you're considering PHS, just make sure you look at the options early, because sometimes the process takes a while. I know that they are working on it to possibly be able to apply in dental school versus waiting until you graduate. But if you do think you're interested in, definitely reach out or make contacts first so they can be expecting you or get things, set up and prepare you for the process. And just don't pass up opportunities because you never know where they might lead. I never expected that I'd be working at a detention center. So it's just very interesting how things played out and everything fell into place. And it's just been easy to pick up and move. The government will pay or the agency pays because they want you. They need dentists. So there's always a need for dentists, and you're valued within the public health service. So other than that, definitely job shadow and reach out to mentors like Dr. Thomas said, professors, or go to conferences and just meet people at conferences and ask about their path, and you may learn something new.
Great. Well, thank you both. Thank you for both sharing your journey to your current career path and giving us some insight into what it looks like to work at ICE Health Service Corps. I know our attendees have a much better appreciation of the vast opportunities available to them if they choose a career in the United States Public Health Service. So again, thank you, and apologies for the minor glitch, but that leaves us plenty of time for some Q&A. So let's get started with our first question. So, you've talked a little bit about this, but I think, maybe, and it doesn't necessarily have to be in your current role, but we'd love to hear it if that makes, sense to you. What has been the most rewarding part of your career? And also on the other side of that, kind of what has been the most challenging aspect of your career? And, it can be in a different role or the current role you're in, just, kind of give us a highlight there. Lieutenant Commander Thomas, why don't we start with you?
Yes, ma'am. So I think the most rewarding part of with this specific job or the career path I'm on right now is that we help people that have no means or very little access to care from the countries that they are coming from. Many times the patients that we see, we are the first time they've seen a dentist. And the oral education and the treatment that we can provide for them is better than what they would have had if they were in their home countries. And that can also cause like a little trickle effect as far as oral education, so that they can, pass that along to their children or even, their extended family. But that with oral education, I think the most challenging part of being with ICE is that language barriers. Like I said, we see patients from all over the world, and my assistant, she, thank goodness she speaks Spanish, but we get people who speak Punjabi or Congolese or Mandarin, and so that, trying to relay these messages and this oral education to them does become difficult. I mean, we do have translator services that we do use with these patients, but we're relying on them to relay a message that we hope that they're understanding.
Yeah, I can see why that would be challenging. Thank you very much. Yeah. Mm-hmm. Commander Ortega, how about yourself?
Yes, definitely. Not only is that is treating the patients rewarding because we do see big stuff, but it's also rewarding that we don't have to, like I said before, meet the production quotas. I'm not forced to compromise any patient care, to meet quotas or make the money to pay for the lights to stay on. So treating the patient, I'm able to treat the patient as long as they need to be treated to get the job done and to do a good job. In my specific job, most rewarding so far is that I started from scratch. Like this was a new facility, brand new. When I got here, still undergoing construction. And now we're operating as a fully functional dental clinic and meeting the needs of the agency. So it's just been nice and rewarding to see, what we came from to what we're doing now. And yes, definitely a challenge with the language barrier. But if you get a good assistant and definitely Spanish speaking, it does go much smoother. But yes, we have the translation services that are very helpful, that you learn to work with, just an adjustment period. And my thing that was also challenging was learning electronic health records. So finding out how can we do this really efficiently and legally to document things on this electronic health record that's only made for ICE, so it's a little different than anything I've worked with before. So,
wow, that does sound challenging. Oh, goodness. Well, thank you both for that wonderful insight. So one question that's come in is, how has dentistry changed since you started practicing? Commander Ortega, do you want to take a stab at that question?
Sure. Just to go on what I was just talking about with the electronic health record.
Yeah.
When I graduated, it was definitely, it's become more electronic. So no more paper charts typically. So electronic health record, digital radiographs were just coming out, I guess, when I was graduating. So we were still doing, developing our own x-rays. So that's come a long way since then. And then dental implants are definitely more popular, more affordable. Dentists, not here, but dentists are placing and restoring a lot of implants that just weren't the standard or weren't available when I was in school.
Great, thank you. Lieutenant Commander Thomas, anything to add there?
Yeah, I think the future of dentistry also looks like in lasers. Right now, lasers are being used, for impression techniques to get better, to be able to, with how she was talking about with CEREC and same day crowns. They're using lasers for soft tissue, but they're now also using lasers for hard tissue removal. So I think that might be in our future as far as, using lasers to excavate, cavities or caries, as opposed to using a handpiece. But I think but everything else she talks about is really, especially electronic medical records are kind of the gold standard now. And now we just recently at our both of our facilities, we just got intraoral cameras. So now you're not just telling a patient, oh, you have a cavity on, this tooth, or, this tooth is badly decayed. You can show them, on your screen exactly what you're talking about. They're not having to hold a mirror in their hand while you're, pulling their teeth out and, trying to explain to them what they're looking at. You can show them right on the screen of, a high definition picture of exactly what we're seeing. So I think I think those are the two main things that I see as far as that's changed, since I graduated from dental school.
Sure. And I think you kind of touched upon my next question a little bit when you mentioned lasers, but what do you see any other advances other than the ones that you've mentioned? What kind of advances do you expect to see, in the next 5 to 10 years? Are there any other, elements that you think will really kind of be the gold standard, I think, as you mentioned, Lieutenant Commander Thomas? I'll throw that question to you since you were already talking about it.
Yeah, sure. So, going to some of our conferences, I've seen a lot of advancement in restorative materials. I think that's a big market nowadays. And I think that's where we're going to see, better materials that last longer, that are, that'll help patients, carries risk. I think that's a big thing. And then as Commander Ortega was talking about with implants, replacing teeth isn't, you're not using wooden dentures anymore. Like, you're now able to replace teeth, and it'd be a permanent thing as opposed to being removable. I think that dentistry is going to be moving away from removable prosthetics and more towards permanent prosthetics.
Very interesting. Thank you. Commander Ortega, have you seen anything else that you'd like to share?
Yes, and this is off of me working on my dental public health residency here. These are some hot topics that are rising, and most definitely we're going to see more in the next 5 to 10 years. So not just lasers to remove caries or cavities, decay. We may not even have to remove caries or decay anymore. If anyone has heard of silver diamine fluoride or SDF, studies are showing that it's actually arresting cavities and preventing cavities. So this magic sauce is going to be this new thing in dentistry, and I think it's going to really change how we need to be offering patients, the possibility that this could work, this could stop it before we actually have to drill and fill. So easy to apply, pain-free, so great for kids, cost-effective, and I think that's definitely going to take off, along with the idea of having mid-level dental providers in the dental workplace, so kind of like nurse practitioners and physician assistants. I think the dental world is going to have more dental therapists, like we see on Indian reservations up in Alaska, and at some other states that are getting approval for dental therapists, so that we can expand dental services to where the need is really great and high, that dentists may not be able to reach everyone in those areas.
Absolutely. Certainly something that is a topic amongst my colleagues here at ADIA. So thank you very much. So just kind of two final questions. One question that's come up before on our series of webinars is, how do you manage to incorporate your other passions, so non-dentistry specific passions, into your career? And I really think that's a great question, and I think it's an important part of having a balanced work life. So if you want to kind of talk a little bit about how you manage to do that, that'd be great. Commander Ortega, how about we start with you?
Well, right now, my life is not very balanced because I'm trying to do school as well part-time after working full-time, and also having family time. So it's a bit challenging now, but definitely before I started that endeavor, I really enjoyed more time that I had with my family, friends, and traveling. So I felt like in PHS and not worrying about all those other things that I might need to worry about in private practice, I had the luxury to enjoy them. We, as PHS officers, get 30 days paid vacation, and you can carry over up to 60 days each year. So if you want to take a couple weeks off, there's usually, if it's okay with your supervisor or throw it up the chain, usually there's, they want to make the dentist happy. So if you want to take that time off and you have those days available, there's usually no issue with taking time off. So it's very flexible in that sense. And even a flexible work schedule. So depending on your agency or depending where you're working, they may offer like 4/10, so you don't have to work on a certain day of the week, or work from home. So things like that. It's flexible.
Great, thank you. Work from home, I didn't even think that was an option. So great. And Lieutenant Commander Thomas, how about yourself?
Yes, ma'am. And I completely agree with Commander Ortega. The work-life balance, she's taken on some additional challenges for herself, but with the time off that we're afforded, and we don't have to worry about a business. We're just we worry about our patients, but when we go home, we go home. It's a great work-life balance, being in the PHS and working for IHSC. I'm able to, I haven't missed any T-ball games or any gymnastic recitals, and so it's very doable as opposed to some of my friends who are in private practice. Their time is money. And that's nice not to have to worry about that aspect of dentistry, the business aspect. And I think that's what drew me the most to public health service, was that I would have that work-life balance, and I would be able to do the things that I enjoy, outside of dentistry.
Right. Great. Thank you very much. Well, final question, and not too complicated, I hope, but you both kind of talked about not really knowing a lot about USPHS career opportunities before, entering dental school. So, for attendees on the listening in today, how can they find out about these opportunities? Is it, something that they find out through their dental school? Is it online? Where are the best places they should go to find out about these opportunities? Lieutenant Commander Thomas, how about we start with you?
Online, there are very good resources. We also, within the USPHS, we have our own website, and you're able to look at the different agencies and different locations of where dentists can be stationed or located. That can, location, just like a really location. And, if you're happy with where you want to go, then I think that's a good start for people to look at, to see, do I want to go to Tuba City, Arizona, or, some of these more remote places, or do I want to live, in a big metropolitan area like San Antonio, or, well, I guess that's relatively big for us. Or, there's places in San Diego or LA. I mean, we're all over the place, but that's a good place to start, is to just look online and, just look up USPHS, and you can at least see where you could be. If you're trying to get closer to home, or, you want to live by the ocean. I mean, there's all kinds of, there's so many variables to why you want to go, why you could or would want to be in the public health service. See here, Commander Ortega, she's moved multiple times, and that is something that's also a benefit of being in the public health service. If you want to move, you can, but you don't have to. I mean, you could technically stay in the same place that you're at if that's where you're happy. But I think online is probably your best resource for looking into public health service. And we also do recruitment events at some of the bigger conferences, like the ADA conference every year, and also we have our symposium, which is in Glendale, Arizona this year for the public health service. So these are some things that you can kind of look into to see if this is even something that you would be interested in.
Great, thank you so much. And Commander Ortega, was there anything to add on that, or did the lieutenant kind of cover most of it?
He did. He covered, USPH.gov, PHS.gov. So if you go to the Public Health Service website, gives you an overview. But also, I did want to mention within the PHS, we do have the different categories. So within the dental category, we have what's called the Professional Advisory Committee, so the Dental PAC. So if you just search Google USPHS Dental PAC, PAC, you can get a list of all the current voting members who are participating in the advisory committee. and there are emails on there. So if you want to reach out to any of those people, I'm sure they'll be more than happy to give you an earful and tell you about where they're at, or what different things they've been through and how to get where you want to be.
Perfect. Well, again, thank you both so much. These were great questions as well. So thank you, everyone, in attendance and sticking with us through the glitch. I appreciate it. This was some really valuable information, and I truly hope and I know that attendees have a better understanding of some of the kind of different opportunities that the USPHS has to offer. So thank you again. Thank you for sharing your story. Thank you to everyone who tuned in. And just one last pitch, because I do work for ADIA. Be sure to check out the ADIA Go Dental website. It's adia.org/GoDental. As often as you can, we always are offering free events like this one and many others, both in person and online. So we definitely hope you'll check us out. And thank you again, and we'll talk to you all soon. Have a great afternoon. Thank you.
Thank you, guys. I appreciate you listening.
Thank you.
Thank
Bye.
you.